the role. I'm not trying to sway people to not have health insurance, all
Right,
that, but
right.
it's more of like you don't need like the high premium. Like paying more for health insurance doesn't actually equate to better health outcomes.
Right.
Is really at the end of the day. That's just how it works. But I think
Yeah.
they've kind of as a society.
What is up, everybody, and welcome back to another episode of the Breathe and Air podcast, where everyday action meets extraordinary mindset. Today, we have the founder of Members Health Co. here in Nashville, Dr. Rahul Iyengar. Thank you for joining the show.
Yeah, thanks for having me. Excited to be here.
Yeah. So, I mean, you're in this profession, right? We've heard a lot about the healthcare industry, and with COVID and everything, I think people started looking at the healthcare industry from a different lens. Like for you, when you first started to get into this, what was your decision to say, like, hey, I want to get into this industry in the first place?
Yeah, I mean, going into healthcare, obviously, most doctors do you go into because you want to help people. So that's really like the whole goal with medicine was just learning how to help people better
Yeah.
with sickness and in health. I was actually a personal trainer in LA before becoming a doctor, so
Nice.
I was always more health, fitness, nutrition oriented, and I thought I'd be seeing people like myself and just like regular people
Yeah.
that I used to know. And then going into the healthcare system through all medical training was pretty eye-opening of like what is going on in here, and it was
Yeah.
all just treating symptoms and all just
Mm,
seeing these like super specialized like I don't know doctors and everything, and
mm.
90% of it we could have prevented, and that's what I
Yeah.
hated of like why are we not talking about the prevention part of it. And
Yeah.
like I don't know, it was so much easier to prevent it, like the third line treatment for diabetes versus just preventing diabetes. I don't know, that's what was missing in the system.
Yeah.
So that's what kind of led me to leave the system. But most of
Right.
my time, like as a, I don't know, training as a doctor, all that was just really focused on putting band-aids on symptoms, which is not what I trained to do. So
Yeah.
showing people there's a different way out there too.
Yeah, absolutely. When you think back to like some of the curriculum, right? Because people, understand that you're a trained physician, et cetera, but they don't understand what goes into that. They just know it's a lengthy process outside of a typical degree, right?
Yeah.
But like when you're training, what are some of the things that were eye opening for you where you were like, okay, I'm learning XYZ, but maybe not some of those preventative pieces?
Yeah, I mean, one, the human body is amazing. Like the level of, I don't know, all the different receptors and like chemicals and stuff that's going on in both of our bodies right now just to keep us breathing without us like feeling it is
Yeah.
amazing. So there's a lot going on in there.
Yeah.
It's a long 11 years of training. So we learn a
Yeah.
lot about every receptor, every organ in the human body and how it all functions. But a lot of it is also focused on what happens when it stops functioning or abnormalities. And a lot of us, that's kind of the mindset we have of like, I go to the doctor when I'm sick. And that's really what I'm trying to change now of like, why are
Yeah.
we waiting till you're sick to go to the doctor?
Right.
A lot
Right.
also plays into the fact that like, let's say, I'm not sure if you have a primary care doctor or not, but if you try to get one, it's probably about a 6 month wait in
Yeah.
Nashville, if that. So it's like, if you're healthy, you're like, well, why might I wait 6 months to even get in and finally get in there? And you spend 5 minutes with a doctor. And I'm guilty of this too. As like when I was on the primary care doctor side of things in the system, someone healthy comes in, I'm like, okay, what are you doing here? It's like
Yeah.
you spend 5 minutes. It's like come back when you have a symptom almost, which is,
Yeah.
I mean, yes,
Right.
there's like minor things that come up too, but compared to like the last five people I just saw who were like very, very sick or like don't need to go to the ER, all this kind of stuff, then you walk in,
Right.
it's like, well, you're fine. Like that's like,
Yeah.
don't worry about that. And it really skews your entire perspective medically too. And that's why doctors do sometimes get a bad rep of like they weren't listening. They just kind of blew me
Yeah.
off with their minor concerns and stuff like that. But they are really trying their best. The issue really is kind of like who's pulling the strings behind that.
Mm.
If I have 40 people in a day, I don't have time to spend more than 5 minutes with you. And that's what I hated about the system too, is that it's really built towards that. A lot of it's dictated by insurance reimbursements. And so they quietly make all the money, but also
Yeah.
doctors are the front line trying their best to juggle 40 people a day, all these different prescriptions, all these
Right.
different, I don't know, there's so much going on there. But
Yeah.
a lot of it's still just geared towards symptoms. So if you come in and you're like healthy, we're not trained for that. It's always like patient comes in with these symptoms. And what do you do next? Not like patient comes in feeling healthy. It's like crickets of like, what now? Of like, why are
Yeah.
you here then?
Yeah.
So on both ends of it, I think that's what I'm trying to change to the culture too, is like come
Yeah.
to the doctor when you're healthy. Let's
Right.
just keep you healthy. That is so much easier and so much cheaper for everyone.
Yeah, you mentioned like the 6 month wait thing. I had a experience with that too. Like any like recommended or highly rated primary care physician in most, I would say, local areas are gonna have like a 6-month wait time to get seen. Like, why is that?
Yeah, and that's just because again, like, I don't. When I was in the system, I had no control over my schedule. So that's
Yeah.
what some of my friends would text me eventually later after the fact of like, "Hey, I tried to get in with you. You said you were booked, and I had to go to the urgent care and stuff." And I was like, "Why don't you just text me directly? Like, you're my friend, like all that kind of
Yeah.
stuff." But it's all stuff where you have no direct access to your schedule as a doctor on purpose. But I
Yeah.
think, anyways,
Yeah.
but. It's really just dictated by insurance reimbursement. So when I first started training, primary care doctors were seeing maybe 10 to 15 patients a day. And then after 11 years of training coming out of it, like if I took a job as a PCP, it would be starting at roughly 20, like 30 people a day. And they kind of put it on
Jeez.
you of like, well, you don't have to see 30 people a day. Like you could see 20, you're just not going to get paid as much. And they put it on you as a doctor of like, well, if you want to make more money, you need to see more patients, but that's on you. And they kind of,
Okay.
and I don't know, but it's a good system design, but horrible for health. I think that's
Right.
generalizable to the entire healthcare industry of like it's a
Right.
really well built system for business. It's horrible for actual health outcomes.
Yeah, because I mean, geez, 30 patients a day, even 20. It's like what
Yeah.
math off the top of my head, you work an 8-hour day. I mean, you're seeing them,
Hmm.
it's bang bang.
And that's why it's like that's why they're booked for 6 months. It's just like they have so many people that are, I don't know, they're taking up those slots. And that's why if you miss that appointment, it's like, well,
It's
next
like,
slot's in six
yeah,
months
see
or
you in a year, buddy.
yeah. But that's also the problem when you go to urgent care or something, they're seeing 60 to 80 people a day. And their whole goal or an ER, and it's like when people go there, they have bad experiences of like, well, they didn't even listen to me or they didn't even do anything. And it's like, yeah, their goal, like that job, like I've rotated there too. They're like, are you dying right now? If you're not dying right now, go follow up with your primary care doctor
Right.
because that's really what their job is of like is life or death. And that's just not their job to focus on prevention or I don't know, do more long-term care management is more just like stopping the acute
Right.
issue now and then follow up with your PCP, which is supposed to be like your main point of contact that actually knows you, but that's
Right.
what it used to be, like old school medicine. But that's what I'm trying to bring back is more of that of old school medicine
Yeah.
feel, like neighborhood doctor feel, where that's really what's missing. And I think the whole health industry, even into like the optimization space and all these boutique wellness places
Yeah.
now,
Yeah. Yeah.
is just time, like with an actual doctor
Yeah.
that knows you. Because that's really the problem. It's like if I don't know you and you come in with like, I don't know, a cough, and it's like, I have 2 minutes to really come up with a decision. I'm like, I'm gonna probably just give you like, just to be safe, like we'll get a chest X-ray. Just to be safe, we'll do like whatever it is, antibiotic, whatever. It's like if I just have more than 5 minutes,
Yeah.
10 minutes, 20 minutes to really kind of dive into that, also
Mhm.
just know you, your lifestyle, everything. That really is what's important. Like maybe you don't even need imaging or antibiotics, or it's like, oh, you've had this cough for like years. That's not like a right now
Yeah.
problem. But it's all the stuff like the context and like that relationship.
Yeah.
That's what's missing that in the health space. And that doesn't, it's not some fancy gadget or new wearable or new supplement or whatever it is. It's just time. That really is like what I'm doing now in my clinic is time to know you, time to be
Yeah.
available. That's really it.
Yeah, it seems to be almost the reverse of where everything else is going, where it's like
Hmm.
automation, AI, how can we
Yeah.
churn, make more money, see more patients, do these things and tasks more efficiently when in retrospect it's like medicine should be personal, it should be thorough, it should be above surface level, treating root cause, those types of things, which in today's system it seems pretty broken.
Absolutely. I think we're also in like that kind of a paradigm too, where like people are leaving traditional healthcare, getting wary of traditional healthcare, which I think is rightfully so. But I think now there's all these wellness health centers that are popping up
Yeah.
everywhere, and there's no doctor in there. They will gladly take your money and give you some treatment or some whatever it is, some data or some inside stuff. But
Yeah.
if there's no doctor that's actually interpreting it, what is it actually doing?
Mm.
And that's kind of like the other thing, like having more data, having more I don't know, insights like without that context or without someone being able to explain it, is it really helpful? Or like
Yeah.
have you heard of function health?
I don't know if I've heard of them.
They're like the ones they do like a big lab panel pretty much.
Okay.
Like
Okay.
they're trying to scale
Yeah.
it up, make it accessible for anyone to get blood work anywhere, which I think is great in theory. Doing like the blood work that I do at my clinic essentially is like a full 100 biomarker panel. But the difference is like if you so what's been crazy, like I do the blood work panel on I've done it on over 200 something people so far.
Yeah.
I've only had 7 people have normal labs. So and everyone's young, healthy, fit,
Yeah.
feels good. And it's like, how come only 7 people have normal labs? But
Yeah.
that's the issue I see with like function health is like they kind of know that most people have something abnormal, but they don't know you, and that's really the what's missing. So if something's abnormal, I don't know what your lifestyle is, I don't know what your health fitness goals are. What am I supposed to tell you?
Yeah.
And but they are telling people something, whether it's taking a supplement or taking this or doing something,
Fill
and
in this. Yeah.
but that's not relevant to most people, or I think
Yeah.
that's a I don't know, slippery slope there too of God, probably also makes a lot of money or some of those suggestions and supplement options and all that stuff.
Yeah.
But like my mom always gets told she has high cholesterol and to cut out red meat, but she's vegetarian. And so that's not useful
Oh,
advice.
man.
It's like a nice like analogy kind of a thing of like if they don't know you, what are they really recommending? And is that even useful information?
Yeah. The cholesterol thing, I've heard of a lot of varying opinions on this. Is that a thing?
With like
With
red
like
meat.
red meat, cholesterol, like
Yeah, well, so I mean, I think some people are like, is red meat bad? Is red meat good? Is all this kind of stuff. I think moderation, balance,
yeah,
all
yeah,
that
yeah.
is obviously
Yeah.
biggest thing there. But red meat is a fattier meat, so it is going to have higher calories, going to have higher fat content there.
Right.
It also generally you can normally cook red meat in butter or oil or something.
Right.
So since it's fattier, it'll absorb more of the fats. So
Got it.
you end up just getting that's why it ends up
Getting more of what you're
contributing to
cooking
more
in.
cholesterol, is more just from fatty
Yeah.
just how much fat content's in it, but it's
Yeah.
not inherently bad. It's obviously just checking blood work. Some people are much more prone to accumulating bad cholesterol. Other people can eat red meat all day and their cholesterol looks great. So I really kind of base it off of your blood work, and your
Yeah.
body is so unique.
Unique.
Yeah, and it's like
Yeah.
you need someone that knows your lifestyle to be able to make it useful
Yeah.
for you. So
What about cholesterol and heart disease?
yeah, so that's a big one, but I think there's some other biomarkers too that we
Yeah.
don't talk
It's
about.
hard to break it down to one thing, right? But everyone always talks about, oh, cholesterol is high, you are more likely
Yeah.
at risk.
Yeah. So cholesterol is something that's what forms some of those plaques that we kind of, without getting too into the science of it and stuff. Essentially,
Yeah.
that's what in a heart attack you have a cholesterol plaque that kind of clogs that artery,
Yeah.
causes a stoppage in blood flow. But there's a lot of other risk factors and markers that we can easily test for that your traditional doctor, your insurance won't cover, even though it's like a few dollar test. So, like lipoprotein A is a genetic cardiac risk. That tells me exactly what your genetic risk is for getting heart disease, which is an important factor. Apolipoprotein B,
Yep.
that's your level of circulating bad cholesterol. So that tells me a lot more about what's actually going on in your blood as opposed to just the number. Like,
Right.
what's your actual circulating level of it?
Right.
And the blood test that I do, like a true cholesterol panel to test your actual particle count, that is what's useful to me, not just calculated number. So if you
Right.
go get
Right.
if you get like a cholesterol panel at a regular doctor's office, they're going to do the calculated number, which I've seen is it can be vastly different than the particle count. So
Yep.
if you have like a borderline, just calculated number, that's all I know about you. I'm like, well, we'll just keep an eye on it.
Right.
But in theory, like if your particle count is through the roof, you have a very high genetic risk for heart disease based on the blood work, and your ApoB is really high, and a few other factors. I'm like, that's going to be a very different recommendation on my end for reducing risk compared to,
Mm.
yeah, just the calculated numbers too, which I got the $30 test versus a $3 test. That's not expensive. But
Right.
it's like, why are we not doing these tests ahead of time when it is so cheap to find out and just stay ahead of it?
Yeah. I feel like in this space too, everyone, listens to the Instagram experts and whatnot. There's so many varying opinions.
I know,
They all
right?
seem so polar because polarity has virality. And so
Yep.
people have to like realize that. But for someone who's, ignorant to it, or didn't study medicine or didn't even do some additional research on their own,
Yeah.
they're taking these people for face value. But yeah, like you said, it's hard to say just like one blanket statement in a body that's so complex.
Exactly. And I think that's what people are kind of searching for, whether actively or passively searching or something or hearing it of like, what's that one supplement I'm supposed to take? Or like, what's the
Yeah.
one thing? And it's like, that's not going to fix, I don't know, everything that's going
Yeah.
on, or even some of like the Ozempic and stuff like that. Like, that's
Right.
not going to address any underlying like cortisol or inflammation or food allergies, which I see surprisingly commonly,
Yeah.
which are definitely going to affect weight. Ozempic doesn't address any of that stuff. I'm like, what are we
Right.
actually treating? But it's like people just want the one thing.
Right.
And like, what am I like? I don't want to even get into that. Like, let me just get that one, whatever it is, recommendation. And like, that's not going to fix the root issue. But that's what I'm trying to show people. It's actually quite easy and cheap to find out what the root issue is and come up with a game plan for you, whether it's whatever that is, that's going to fit your needs.
Yeah. Geez, that Ozempic thing's blown up, huh?
Yeah, it really has. Well, I was actually going to ask you about supplements too. Have you
Yeah.
seen or heard of apple cider vinegar on Netflix?
I well, I haven't I know of apple cider vinegar, but not the
But there's the
Netflix.
TV show on
No, what
Netflix.
is it?
In a nutshell, it's this influencer that I'm only 2 episodes in. So I'm like,
Okay.
from what I've watched so
Yeah.
far, someone told me to watch it and I was
Okay.
like, I'll give it a shot.
Yeah.
But essentially it was an influencer that faked having brain cancer so that she could sell organic juices as a cure for
Oh,
it,
wow.
or some supplement,
I
something
think I
as a
saw
cure.
something on
Yeah,
that.
and then but people listened to it, and some people with cancer actually like didn't do the treatment the doctor recommended. Like, I'm gonna do the juice thing instead, and then they died, and they could have probably cured it with
Wow.
chemo or something. But it was kind of like the whole.
Jeez.
I kind of like. I mean, look, so far it's been interesting, just as like I don't know. I think kind of debunking that industry a bit too. Just 'cause I know
Yeah.
right now everyone is very much on like the okay, health insurance, traditional healthcare is like definitely something, I don't know, it's not keeping you healthy.
Yeah.
But this I think was an interesting so far it's been interesting of like, okay, maybe all the supplement stuff is also something we should like vet, or like maybe we should listen to a doctor or
Yeah.
with
Where's the
certain
middle
things.
ground
Like I
again,
know,
right?
right? So I think that was kind of the extreme, the other way of like
Yeah.
people going very supplement heavy and very off of influencers and stuff that don't have medical training, and there's no liability is the danger of it. Like
I was
I
gonna
could be an
say,
influencer and I
what's
can
the
say whatever
liability?
I want to say on there. They are not licensed. They don't have a license to lose. They can say whatever they want. And then if something happens, it's almost like a, well, I don't know you. I didn't tell you to not get treatment for that. Like I was just promoting content. And so there is no
Mm,
liability. So that's what's really dangerous about some of the
wow.
all the I mean, obviously it's free speech too, but it's almost like people consume it so at face value as being true just because it has 5,000 likes or 10,000 likes or like a million views. And it's like, oh, they must know what they're talking about. Let me go buy their stuff. I'm like, do you know how much money they probably make on you buying their supplement? And so it does, I don't know, it is business, I think. And that's what I think makes it dangerous sometimes
Yeah.
too. Of like, I get it if it's for business. It's another thing if it's actually dangerous for your health.
Yeah. The money piece in healthcare, right? I think the curtain kind of has started to get pulled back, and that's why you're seeing a lot of this stuff on the polar opposites rise to popularity over the
Yeah.
last 5 years. Um, I think that lit a fire under it, which is interesting. It's going to be interesting to see how that progresses over the years. But you mentioned, I want to dig a little deeper into this because I think, people listening probably have no idea on like how the insurance world works and kind of why you're doing what you do. Um,
Yeah.
like you mentioned earlier, doctor does 20 patients, they get paid less than 30, or like, and then they're getting paid from insurance companies as well. So like, how does that process flow work? I guess from the money trickling down and how that can get jaded and kind of convoluted whenever money's
Yeah,
involved.
absolutely. Well, I think it's also so skewed. I think people are very much like, oh, doctors get paid a lot of money. And yes, they do get paid well. I still just couldn't sit with the fact of like, let's say I don't know, seeing how 40 people a day or something,
Yeah,
I'm making 250K, which is great money.
yeah,
But knowing that I'm making my insurance person probably upwards of 5+ million a year to make my life hell essentially, and then also not actually do any good work. Like let's say
mm,
I'm over here just cranking prescriptions out, but your insurance didn't cover it. So you go to the pharmacy to pick it up and you can't afford it, so you don't pick it up, and then you just end up having, I don't know, you end up just having whatever happens from not actually getting the medication.
yeah,
I wouldn't know that because again, the doctor, you never actually get direct access to me. You just end up, you try to call, probably goes to voicemail, all this stuff.
right,
And then
right,
I'm thinking like, okay, at least I sent the script in or whatever and trying to help them. And then meanwhile, it's like the pharma and insurance companies are making hundreds of billions of dollars. And I think a society is like, oh, doctors make a lot of money. I'm like, no, the people behind the curtain, like the people pulling the strings, they're the ones making hundreds
yeah,
of billions of dollars.
ridiculous money. Yeah,
Yeah, but it's like, I don't know. Again, it's just like I think, and then it goes all the way back to almost like a full circle with food industry. And like food is also, I think, very intentionally designed to be more addictive and all the
yeah,
additives. Like we finally banned red dye number 3. What about the other 40 of them? And it's like,
yeah,
and it's like even the ban doesn't take effect until like I think 2028. So I'm like, in the meantime, it's like, yeah, this will be banned, but you're still eating it, and
yeah,
all the different things with the regulations and stuff like that, and starting from food industry to insurance to reimbursements and all of it, I think is a really well built system. Even medical schools were originally funded by pharmaceutical companies to learn how to prescribe their medications better.
that's
And so
a
the
that's a
origins of
flywheel.
everything is like the more you deep dive into it, it's like, yeah, wow, this is a really, really well, like brilliantly designed system for business. It's just
Yes,
horrible for health. The unfortunate part of it. Like That's why people make hundreds of billions of dollars on it because it's just again brilliantly designed from start to finish. Of
Yeah.
that's why I think even like now with the obesity thing, it's like instead of addressing the root issue, which is like, yeah, you just kind of subsidized corn instead of actual vegetables. And like that's why we have high
Yeah.
fructose corn syrup and like everything is just additives and processed. And it's like, you know what we need? Ozempic instead. I'm like, no, the issue is the food, y'all. Like, I don't know. So stuff with that where it's like, and
Yeah.
obviously Ozempic's like now being praised as like a wonder drug, which I think a lot of those studies too are like, I don't know, kind of common sense in that sense of like, yeah, if you just lost weight, you would reduce your risk of heart disease, diabetes, everything too. But the reason you have the weight on is because of the
Your
food
lifestyle. Yeah.
and the food access and all that and stuff. But it's all just kind of hand in hand of like adding on another like solution, quote unquote, that isn't actually it's a short fix. And
Yeah.
like that still doesn't address the root issue.
Yeah.
So I don't know. The whole system is interesting in that.
Yeah.
But insurance, though, to your point with like it's been pretty eye-opening now being out the system to see insurance and like the perspective. But I always equate health insurance to car insurance. So let's say you have the like platinum car insurance, you still pay for gas, oil changes, car washes, tires, and that's all stuff that's on you. So
Yeah.
car insurance doesn't cover that. That's why health insurance, like I'll show you like the preventive blood work guide too,
Yeah.
but
Yeah.
like that's why it's like this same panel is $2,000 with insurance. It's $200 when I order it. But health insurance
That
is
is
then
insane.
designed to keep you healthy. That's the whole. I think people fuss about it too, and honestly, it's just not what it's designed for. It's designed for the accidents. So that's what I open my clinic up to really focus on the car washes, the oil changes. Like that's
Right.
what I do essentially. Of like the to preventive maintenance is
Yeah.
so much cheaper and easier when you cut out the middlemen because that's yeah. And then insurance obviously has a role. I'm not trying to sway people to not have health insurance all
Right.
that, but
Right.
it's more of like you don't need like the high like, premium. Like paying more for health insurance doesn't actually equate to better health outcomes. Is
Right.
really at the end of the day. That's just how it works. But I think
Yeah.
they've kind of as a society we view it as a benefit that's kind of how it's
Yeah.
like given to us is like it's a benefit to you. But if you're young and healthy, how is it benefiting you? Or like what you were talking about earlier, I'm like, how would it actually what is that extra $500 a month going to actually
Yeah.
do for you?
Yeah.
Versus like here we can actually get ahead of disease and like find out what's abnormal
Right.
and do the fine tuning, the maintenance, which is arguably more important.
Yeah, absolutely. I mean, it's really interesting because the health insurance piece to me, when I think of it, and I'm sure maybe, people think about it this ways too. It's like if you had a major event happen, you get in a
Mhm.
car accident, you have to have the ER visit, that's
Yes.
$1,000. You God forbid you get cancer or
Yep.
you have to have surgery. Like those types of things, it seems like that makes sense. But to your point, like the preventative care and all the other things that someone told me you can pay the pharmacy or you can pay the farm or you can pay the pharmacy. So it's
It's actually a great.
so it's
I love
like
that. Yeah.
so there is that front piece, right? And then that would cover like catastrophic events, like I
Yeah.
guess.
And that's really what I view. I mean, I always encourage my members and stuff to have at least catastrophic insurance for some of the unexpected. Yeah, like getting a major car accident.
Yeah.
You could be super healthy, everything's optimal, but yeah, life happens.
Right.
But that should be like 80 to $100 a month. And that's honestly what insurance is designed for, is for that.
Yeah.
And then I can do everything else, like all the other, like, well, what if I have a heart attack, all this stuff. I'm like, I could have seen that years coming and just we wouldn't even have to deal with that.
Right.
Or some of the other procedures or imaging. Like imaging is cheaper if I order it in cash than it is for you to try to get it approved through insurance. And your copay is often more than what the cash price is.
Yeah.
Is all the things that have been pretty eye opening. I'm like, oh, even like the price with insurance is it's just not the true price.
Yeah. Yeah.
So
So as you're, having these ideas, realizations, and like that light bulb moment of like, okay, maybe this isn't what I signed up for. What was that process like for you to come to grips with that and then actually take the step to start your own
oh
practice
man.
in a different way?
So I've been trying to get out of medicine since I got in. Like literally from
Yeah.
like the first like month in med school, I was like, this was a trap. This is not. I messed up. Dude. Like I thought healthcare, like medicine, all that would be so different. Really more focused on health, not sickness. And it really is sick care, and it's just learning to manage sickness. So
Mm.
from day one in med school, I was like, I need to find a way out of this. I actually did a master's in healthcare administration at UCSF in San Francisco,
Yep.
and then I actually had a job at corporate Stanford to try to do more like systems level
Right.
change, everything right out of medical school. I wasn't going to do residency or practice. I was
Mhm.
like, this is a systems problem. Like, let me try
Right.
my best to actually fix it on a systems level. But then COVID happened. So California's on a hiring freeze forever.
Yep.
So then residency was kind of an afterthought. But I mean, it worked out the way it was supposed to. I ended up here in Nashville
Yeah.
doing residency. And then from day one in residency, I also knew that I couldn't take a job as a primary care doctor because I don't want to see 40 people a day.
Right.
So from
Right.
day one here too, it was always kind of geared towards like, how do I change the system a bit, at least for myself, and kind of go from there. And then I worked with like concierge doctors. I work with direct primary care doctors, and they're kind of doctors that are doing stuff outside of the system.
Yep.
But like I get asked a lot if I'm concierge medicine, and I'm like, not really. Most concierge doctors charge anywhere from 5 to 8 to 10,000 a year. So it's a much higher price point, but
Yeah.
they still don't really focus on prevention at all. It's still just, and but most people are older by the time they afford that too. So they are really just focused on managing diseases still. And so
Mhm.
that's why, and some of the direct primary care doctors have a lower price point, but again, there's no prevention. And
Yeah.
most doctors too, like in 11 years of training, we didn't have a single nutrition class. So obviously most
That's mind
doctors,
blowing.
it really is. No, it's truly blows my mind still. But very smart people, but it's just like, that's just not part of most of our, I don't know, medical culture is nutrition and prevention and all that
Yeah.
kind of stuff, versus some, I don't know. So that's why I was like, I'll just make my own model and do it the way that I think
Yeah.
health should be, can be. And I launched a lot of wellness services recently too. And big picture wise, like, yeah, like, why are we not doing wellness services at your doctor that knows you and your blood work and everything and like at cost? Like, I do
Yeah.
IVs for $39 and it's like
Yeah.
IV hydration. The hydration is the part of it that really is a benefit.
Yeah.
And also, like, I know you, I know your blood work. Like, you don't need all these extra vitamin boosts or whatever boosts are getting put in these IVs. But again, most hydration places, that's a business. The more
Yeah.
boosts they put in there, the more they sell you, the more money they make.
Yeah.
Which again, I get it for business, no problem. But the issue is like that can be dangerous because that leaches like toxic levels very quickly. There's rarely any doctor actually there. There's a medical director somewhere, but I don't know. I'm not sure where they are actually. But
Yeah.
next thing you know, you have like a $300 like pink concoction going into your arm. And it's like, why is it pink? Like, why is it so expensive? But
Yeah.
I don't know. Just doing it at cost. I'm like, it's only $39. That's the real price of it. But
Yeah.
they do make a lot of money. It's a lot of these wellness and like boutique places, but it's not actually for health.
Right. So you're kind of combining almost the best of both worlds. It's like I want to have a preventative care place where someone who's also can treat it as a primary physician
Yeah.
when they are sick, but we can look at an individualized panel on what they should and shouldn't be doing and kind of treat it earlier as in later instead of so
Exactly.
late.
Yeah. Really trying to blend it all together of like proactive health and wellness at your doctor. But
Yeah.
it's I think that's kind of the same cultural issues. Like people view the doctor for sickness, and I'm really trying to change that part of it. I'm like,
Yeah.
instead of going to these med spas where there's no doctor and
Yeah.
paying way more money, like come to your doctor and stay healthy and optimize your health
Yeah.
without being oversold some add-ons or injectables and treatments
Right.
that are sometimes oftentimes dangerous or just not necessary. Like
Yeah.
have you heard of like Next Health before?
I don't know if I've heard of them.
They just opened up a location in the Gulch, but
Okay.
they're kind of a national
Just
company.
like what's Restore almost?
Kind of like
Restore?
that. Yeah, but it's really focused and there's a lot that are very similar to this of just like longevity, anti-aging clinics that really only focus on that. So a lot of healthy people end up going to that instead of like an actual doctor that's really looking at more preventive like medicine, not just boutique treatments, but they do like cryotherapy treatments and
Right.
stem cell treatments and like exosome stuff. And I was researching it a bit more and like some of those stem cell treatments, they're like ten to $15,000 a treatment.
Wow.
And they're like geared towards like regeneration and like regenerative medicine and cell regrowth. And I mean, there's no studies out there yet, but I mean, big picture wise and just common sense wise, I'm like, you know what cells love to grow already is cancer. If you have any pre-cancer and you're putting a bunch of growth signals, that's probably what's going to grow first.
Yeah.
But they also don't have any direct medical doctors that are overseeing that. Or
Yeah.
again, it's a business. They make a lot of money pushing some of that stuff. But
Yeah.
I don't know. That's what I'm trying to blend too of like before we go way overboard in that direction and have consequences from that too.
Yeah.
I'm like, why don't we just meet in the middle of like just real health that's at cost and really trying to. That's what's interesting too. People spend a lot of money on like red light saunas and cold plunge places and Pilates,
Right,
and
right.
not to like rip any of those. Those are great things, but cost wise, people just spend a lot of money on that, and they come in here and they're like, "Ooh, 199 a month. I don't need a doctor, so I'm good." And it's like you should probably start with this actually of like
Yeah.
get your blood work checked, get a good baseline. I said I was a personal trainer before. So I have like an body composition machine in my clinic as well, so I can actually give you really good like physical
Yeah.
like assessment about what your composition is too. And so a lot of different just health and wellness benefits, but it's interesting. People are very hesitant as soon as they see there's a doctor involved. So
Right.
yeah,
This wave of, cold plunge, sauna, or red light, like, I
yeah.
see some of the videos online and people making fun of it, like my morning routine. I do this, I do that, I oil pull, I scrape my tongue, I walk on, like, ground
Hmm.
myself, like, all these things that, while yes, they're good practices, good to create good habits, like sometimes it's like, what are we really doing this for?
And it's also not
Like,
cheap. That's kind of where it's like you can also feel.
so much money in it.
And it's like that's my goal is trying to take some of the guesswork out of it too. I think especially in the supplement world too.
Yeah.
Even myself, before I actually did my own blood work before starting this, because I could never afford this otherwise. But it's the guesswork of like maybe I need a vitamin. I don't know. Internet tells me I probably need to be taking at least a multivitamin, but I don't know. And you kind
Yeah.
of get in that guessing game of like, should I be taking this thing? Like, what about that other, I don't know, this treatment or that treatment, or should I be doing red light? And then you kind of get into the rabbit hole of like,
Yeah.
oh, you're not doing that. Like you have, and then it's like you feel good. I mean, that's the whole thing. Like everyone feels good
Yeah.
until you don't. And even with supplements, like it will affect your kidney function. You're not gonna have a symptom until one day you do. And you
Yeah.
also spent a lot of money on the supplements and stuff too.
Yes.
But I mean,
Man,
I think
I feel triggered on that one. I
really,
feel triggered.
yeah.
I'm like, give me a blood panel.
Yeah, it's so much cheaper. I'm
Yeah.
like, and that's when like, I don't know. I think that's when people tell you on the internet or people try to tell you like, oh, you should take this supplement, and they don't know your blood work, they don't know anything about
Yeah.
you. That to me is a red flag of
Yeah.
like, what are they selling you? And like
Yeah.
that's something for me, I feel very strongly about is like full price transparency of like, even if I think you need a supplement, like it's at cost. Like nothing
Yeah.
is actually, I don't make money on any of that stuff, which I think is how it should be. But it's more of like, I don't know either. Let's just check your blood work and see what you need. If you need something, yes, I have supplements and stuff, but we can also try to get it in diet. We can try,
Right.
I think lifestyle is the most sustainable way. I don't
Yeah.
think we have to take supplements. I think that's something that's kind of being ingrained in us now of like, you have to do this, you have to
Yeah.
do that. It's like, no, you just have to eat a balanced diet, really, and move a little bit.
Yeah.
It's kind of like the underlying statement, I think,
Yeah.
to health.
You mentioned that, but like, when you hear a lot of the noise today in the health space, what's one of the biggest thing that just makes your skin crawl that you're like, this is not right?
I mean, I think really just the lack of like, there is no one medically trained that's out there on any of these platforms or on any of these
Yeah.
like services, or if they are, it's like, I don't know. I think the CEO of like Nextel, I think is a surgeon or something. And it's like, I don't know,
Yeah.
not to rip on surgeons either, but
Right.
it's like, that's not really what you trained 13 years for. And
Right.
it's like you trained 13 years to do like this knee surgery. Now you're telling me you're doing health optimization over here. And I don't know, I
Yeah.
think that's such a big pivot, which again, not to say that that's not possible, but
Right.
also how much money do you make doing that in your company, promoting longevity treatment? And a lot of times I also ask them like, do you do them yourself? A lot of times they don't actually, but
Yeah.
I think that's my biggest, I don't know, what I see that out there is like, there's not much medical anything involved
Prowess.
in that,
Yeah.
but they're all more expensive than what I'm doing in my clinic. So that's what it's like. Depending on people spend a lot of money on it, and I think
Yeah.
there's a lot of room for growth in the health space. But that's kind of where my I don't know, my
Yeah.
just common sense. I'm like, why don't we just talk to a doctor with this? Or
Yeah.
even if ChatGPT tells you something, which is great, but it's like you still do need a doctor to oversee some of it. I think the AI
Yeah.
space is kind of evolving too, but it's also there's no liability there either, and like you
Yeah.
can't really take it at full. I don't know. It'll tell you what you want to hear. It's kind of the issue with the internet these days, or
Right.
social media. You will find what you want to
It'll
find.
feed you what what you're gonna engage with. Yeah.
Yeah,
That is the scary thing. You gotta remind yourself that there's algorithms driving everything that's put in front of you so that it keeps feeding what you've already engaged with or shared or liked or
yeah,
looked at a little bit longer. Like,
definitely.
the intricacy of keeping you engaged is next.
know,
I mean,
right?
it's beyond comprehension, really.
And I think that's kind of the biggest thing that I would want people to do is like just think before you buy that little ad that you saw and like, oh yeah, maybe I'll just buy that supplement. I'm like, no, like what are you like maybe research it a bit or
Mm.
like ask a doctor that knows you. I'm like, hey, that's what I love doing for my patients is like if you like, I don't know everything. I'm not gonna pretend I do, but I have time to research it and actually get you real answers and
Yeah.
see if it's legit. And I
Yeah.
can tell you medically if I think that's great or not. Versus some of the stuff out there, I'm like, no, that's actually really dangerous. Like, don't do that. But
Right.
other stuff like NAD, I wasn't really familiar with NAD. I think there's a lot on social media about NAD and stuff these days, and I researched it, and I actually think it's great. Actually, I incorporate it into my practice as
Yeah.
well. I just think that the IV form is dangerous. Most of these meds possibly about, yeah, only the IV form, which is 10 to 15 times the suggested dose all at once. I'm not sure if you've gotten one or if you know anyone that's gotten an IV
Those take a
NAD.
lot longer, right? I haven't gotten one, but I know that they take
Yeah, it takes
the
like,
drip takes forever.
and even then, it's like everyone else that's gotten one is like nauseous or throwing up or has chest pain and sweating. I'm
Right.
like, yeah, it's a lot of dose to get at once. It also happens to cost $800 to $1,000 a treatment.
Right.
There's also not really a medical doctor anywhere in the building, but the issue, they're right, it doesn't absorb orally well at all. But there are shots which are $15 a shot is the real cost,
Yeah.
or a nasal spray which is $50 for daily nasal spray for a month.
Yeah.
And it's like that's way cheaper. You get the same dose in a month. He just also makes sense. Why don't you spread it out over a month instead of taking a massive dose once a month and spending like $1,000 every month? But they don't tell you about that option because they make a lot more money on the IVs forms.
Right.
But that's what I love, kind of researching stuff and getting people real answers, but doing it at cost. Like, don't
Yeah.
spend your money on that. Like, I use NAD now. I love it, the nasal spray though. But again, it's $50 for the month.
Yeah.
Like, save your money on that. And anyone that's telling you more, they are just upcharging you.
Yeah. When you look at a lot of these panels, and like I think you mentioned earlier, there's, a lot of younger people that come in, and you have a clientele that's focused on, their health, preventative, and using you as a resource for when things are going south. But is there something that you've seen more consistently in some, like in a bulk of the patients, in terms of like deficiencies or issues that are coming up?
Absolutely. And I think things that surprise me a lot is how many people are pre-diabetic. And and again,
Wow.
that's something you would never have a symptom of it. And your doctor will, like their classic doctor will never test your A1C because it's based on your fasting glucose. You're like, oh, your fasting glucose is normal, so you're not pre-diabetic. And that's something that we're trained to, unfortunately, like indoctrinated in us. Like,
Yeah.
if I saw you out on at least 2 labs on you, or maybe 3 labs at your annual physicals, people are
Yeah.
telling me like, I got my blood work checked, everything looked good. I'm like, no, no one's done this full blood work panel on you. But yeah, surprisingly high number of pre-diabetics where you don't have a symptom of that until eventually you're advanced diabetic and then you're on multiple medications that
Jeez.
happen to cost thousands of dollars also. But
Yeah.
but that actually a lot of early autoimmune, which also surprises me, where autoimmune is something where you may not have symptoms at all in the beginning, and then once you start to have symptoms, it advances pretty bad, and you
Rapidly.
need these really crazy medications that really suppress your immune system, and also happen to cost tens of thousands of dollars.
Mm.
But a lot of it is just when we catch it early, you don't have symptoms of it, and that's really
Yeah.
what I'm trying to show people too. Like, you feel healthy, great. That's really my goal. Let's keep you feeling healthy with simple lifestyle changes. Like when you catch it early, like yeah, even like prediabetes, is diet, just some simple diet tweaks.
Yeah.
Or like decreased kidney function is a big one too, where you're not going to have a symptom of that probably ever until it's actually failed. But
Yeah.
I see that a lot in people that are taking a lot of supplements or creatine and stuff like that, where that can affect people's kidneys differently. And
Yeah.
again, you're not going to know until you again, just get it checked. It's so much easier. 'Cause I
Yeah.
don't know either. Just looking at someone, that's what I've learned too. Is like I can look at someone that looks like the healthiest, athletic, and they're eating all the right things, and they could still have really high genetic risk for cardiac disease. They could still be pre-diabetic. They have really high inflammation. They're eating a healthy diet, but something in there they have a food allergy to. A lot of people have food allergies that I've seen that didn't realize it.
Yeah.
And then they cut it out. They lose 20 pounds in a month or two. And
Wow.
just from inflammation, they suddenly feel better. And then in hindsight, asking them, it's like, do you feel better now? It's like, yeah, I didn't realize I had a symptom because that was just my normal. So when you ask them too, like they thought they felt healthy.
Yeah.
And and that's what's also
How do you
interesting
base
too.
that? Yeah.
If they've been kind of having inflammation and food allergies their entire life, that is their normal. So they don't know any better until they actually address it too.
Right.
Which again, there is no medication involved in that. There is no like procedure or injection. It's just lifestyle changes.
Yeah. Is the allergy piece, is that through blood work too, or how do you
Yeah.
yeah.
So I do a food allergy panel on everyone. It's $65. That's just the cost of ordering it. But
Yeah.
yeah, just for the major food allergens. But I also always caution and always tells people about like true antibody mediated allergies. So
Right.
if you have food sensitivities and stuff, that's not going to show up on there. But Also, my thoughts on it, like, I don't think there's any good test that will test for sensitivities.
Yeah.
Like, I'm sensitive to fried food. There's no test out there that's gonna tell me that. I just know if I eat
Yeah.
fried food, I'm gonna feel like crap.
Yeah.
But that kind of a thing too, that think a food symptom log and having it out, like going over that with my patients, like that is so much more insightful for me.
Yeah.
For you, it's free, and that's way more than spending all these thousands on tests and stuff. That again, more data isn't necessarily more helpful.
Right.
So
It could be an overload at that point.
yeah,
In another thing that's kind of started to come up a lot is in men is testosterone levels.
yeah,
And like we've talked about lifestyle, all of the different things that, plastics and hormone disruptors and endocrine disruptors, all these things in our environment now that we're exposed to. But I have been so surprised by a lot of my guy friends that have gone and got blood work panels and have said that they have like the low, like super low testosterone
where are
levels.
they going to get it checked?
I don't know. Probably just like I don't know. Probably one of those
That's
like
what makes me so
lab places that you're
yeah.
talking about. Yeah.
Because that's what makes me so nervous about some of these like TRT clinics, or just like
Yeah.
if you just go and check only testosterone, that doesn't tell me anything.
Right. Right. Right.
So you need like the whole panel really, to see exactly what's going on. So I have a lot of guys that do have lower testosterone, but doing their full blood work panel, like I know exactly why.
Yeah.
And never it's like I've never had a guy, I'm like, I don't know why it's low. It's like there's always something telling me, whether it's high cortisol, if you're in like a high like fight or flight state,
Yeah.
reproduction is such a low physiologic priority that makes sense. The root issue is fixing the stress state, not
Stress.
boosting testosterone. Or same thing with like if you have like no vitamins at all, yeah, it's gonna affect testosterone production. Or inflammation or food allergies. Again, all that kind of stuff disrupts your metabolism and your hormone health. But really trying to figure out the root issue for most people. That's what boosts testosterone naturally. The issue is just supplementing it or taking like a testosterone booster.
Yeah.
That's going to affect the way that your body naturally makes testosterone, and it's pretty much suppresses your natural signaling for it. And I see a lot of guys that I don't know. I'm like, why are you 20s, you're 30s? Like, don't
Yeah.
like the people talk about TRT and replacement, which does have a lot of health benefits for men that are 50 plus. But when you're 20, 30, and like that is setting you up for failure. Of
Yeah.
like you will just shut down your natural production of testosterone, and that's kind of also what they probably want, because then you're just on it for life.
You
And that's
gotta stay
expensive.
on
It costs a lot of money, but they also don't tell you what I think is scary is that if you go to a TRT clinic, they're not legally required to tell you the risks of testosterone. They're allowed to just tell you all the benefits of it. Like you're gonna build more muscle, you're gonna have the best workouts of your life,
Yeah.
great sex life, everything. And
Yeah.
it's like, but they don't tell you the risk. And the risk is also like risk of blood clots, stroke, heart attack, all go up through the
Yes.
roof too. And that's why you see some of these bodybuilders and stuff that drop dead in the 40s. And
Mm.
it's like, yeah, it's a dangerous thing too. But again, there's really no medical anyone kind of in these TRT clinics. They just make money.
Yeah.
But that's why I think testosterone is a great thing to get checked. But I think having a medical person oversee it,
Yeah.
like if you get it checked now, it's gonna be low. There's peaks in the morning. I think like, I hear people, I'm like, I got to check in the afternoon, and it said it was low. I'm like, yeah, of course it's low. That's just again skewing your results to whatever it is. But
Right.
it has to be first thing in the morning. Even then, hormones do fluctuate, and there's a lot of things you can do to optimize it. A lot of it is food related too. Obviously, building more muscle, getting good
Yeah.
sleep, lowering stress, all things that are naturally going to boost testosterone without needing to supplement it or boost it. Or I would not trust any supplement that says it's going to be a testosterone block or booster, because like you don't know what it actually is doing. You don't want to mess with hormones. Hormones are it's a really beautifully designed circuitry system in your body
Yeah.
of like signaling, and it's all there for a reason. As soon as you start introducing something to it, it's going to mess up the entire signaling pathway, and you may not get that back after. So
Yeah. I had the idea as we're talking. I'm gonna come to Members Health Co.
yeah,
I want to do a
come
full,
get your lab checked,
full transparent blood work,
and then we'll
panel.
go over your labs. We'll go,
Yes,
yeah.
we'll go over the labs. You guys can get the sneak peek. I know I share a lot of this stuff with you guys. So, yeah, I need to do that because, for the longest time, I was always interested in that space, right? Because I was an athlete and I wanted to train and I wanted to
Oh, nice. What'd you
be the
play?
best. Played football
Oh, nice.
in
Yeah.
college. So that was it's a different level though, right? Because it's like, I want to just gain a bunch of weight. I
Yeah.
wasn't as conscious of the food. I was just trying to get bigger and stronger. And so I was kind of just like eating as much as I could, working out really hard, lifting heavy weights, like basically strength training and powerlifting and like doing all those things. But when I got out, obviously that all changed because now if I knew what I knew now, then I would have done things differently. Let's just put it
What
that
would you
way.
done differently?
Just the I was focused on quantity and not quality.
Yeah.
Also, I was a broke college kid, so there was that piece
Well,
too. I kind of
yeah, plays a
kind of
role
had
in
what
it
was
too.
available to me at the time.
I think that's my views on,
But
like, calorie counting and macros and stuff, and it's
yeah,
like, I care more about, like, what's on your plate, like, quality of it. Like, a
yeah,
calorie is not just a calorie. Like, the
yeah,
quality of it matters so much more, but,
yeah.
yeah, I think what you're saying with
It's
quantity is
like,
quality.
yeah,
Quality definitely matters, so
yeah. It's funny. My mom used to always be she was ahead of the health curve. She was all organic and stuff when I was younger, and I was always max. I'm like, Mom, why don't we have Pop Tarts and Coke at the house? Like,
Yeah.
little Jimmy come over, who don't even have any Coke for him. Like,
Yeah,
what the
yeah, yeah, yeah.
hell?
That's funny.
But looking back now, I'm like, okay, I'm glad that some of those habits were instilled early on.
Definitely. I think that's a
But
huge I really do think food is medicine. I think that's
yeah,
something, especially here, it's so tough in America where we just don't have access to fresh, healthy food. Or if we do, it's super expensive. Or
yeah,
then you have to cook it still. And it's a lot of barriers to actually
yeah.
eating healthy. But I'm actually launching a meal prep soon. It's in partnership with two different nonprofits. They both make meal prep.
It's awesome.
One makes meal prep for cancer patients, the Heimerdinger Foundation. The other is a National Food Project. They make meals for underserved populations. But they all locally source their food from local farms. I'm excited to just have them have their food available
Yeah,
for people and just eat healthy food.
yeah,
So, but I think food really is then showing people healthy food is
yeah.
easy. It can taste good. I think that's really a big
Yes,
part
I
of
can.
all of it. Of like, make sure it tastes good. Like forcing your way through a kale salad, that's not sustainable if you
Yeah,
don't like that. Like,
yeah.
I don't know. It has to be enjoyable, obviously. So
No,
balance is
100%.
everything.
Yeah, it has to be enjoyable for it to be sustainable, and that's why when I look at a lot of these fad diets, while like they can in the short term, accomplish a certain goal, is it sustainable? Like, okay, carnivore, you're gonna probably lose weight, lose inflammation. You're not eating carbs. You're not eating processed food. Like, sure, but then
At what
how are
cost?
your workouts? How's your
Yeah.
sleep? How is your hormone? How are your hormones with like no carbs? Like those types of things.
Yeah.
Um,
And I think that's something too of like, I don't know, people try to like, oh, carbs are bad or fat is bad. I'm like, everything's bad if you're eating it excessively. It's like
right.
just moderation, having a balance there. There's a reason that we need protein and carbs and vegetables and fiber, like all the different things. The food pyramid essentially, it's there for a
Definitely.
reason. It's just obviously the quality of it definitely matters more than like the nutrition fact label.
Yeah. With your background in personal training and like how did you used to train? Like would you ever
Oh
into
yeah, I
bodybuilding or
have
like
come a full
marathon?
180 from
Yeah.
that. I was a rock climber in college too,
Okay.
but
Okay.
I was probably a 40 to 50 pounds heavier than I was now. Like I had a lot of more muscle.
Yeah.
I was also probably eating like 8 or 9,000 calories a day, which
Woo-hoo!
cleanly is really tough. I
That's
was
super
always
hard.
uncomfortably full but I was also working out 3 or 4 hours a day, like training people, also exercising myself, also rock climbing. Honestly, overall, probably super unhealthy
Yeah.
and just also not sustainable. I kind
Yeah.
of did it just to see if I could get up to 220, and I
Yeah.
did. And then I was like, okay, I'm not sustaining this anymore. I went back to eating regular amount, like 3 to 4,000 calories a day. I lost weight pretty quickly,
Yeah.
and but it was more just to see if I could do it. But
Yeah.
it's just not
Yeah.
sustainable. But I've also changed my workouts completely. Where
Okay.
when I was a trainer, all I was taught was form of like have perfect form with every exercise,
Yeah.
and which yes, obviously that makes sense. But medically, I've seen pretty much every athlete, every trainer and stuff when they are 50 or 60, and most of them look like crap.
Mm,
And it was always just that one rep that wasn't perfect form, and that's all it took to like completely herniate your
right.
back, your knees, your gone, and then it's like you will never fully recover from that. Or people sometimes just stop working out altogether. It's like I had a big injury, I'm just not going to work out, and they lose all like their muscle mass, they lose all their
Yeah.
training, or they're on pain pills now the rest of their life, and that's not helpful or sustainable for long term health either. So I switched my own workout philosophy too of just like really root cause kind of thing. Like, what are your health fitness goals? Like, are you
Right.
trying to win a powerlifting competition? Very different goal than obviously of like, I just want to look good and feel good for the rest of my life. Like, great, we can do very different exercises.
Yeah.
Like, you don't have to do the craziest, like, I don't know, squat, power lift, like thrust thing. Like, you could just do a leg press
Yeah.
machine and you can get almost all the same strength with like minimal risk of injury
Yeah.
versus like squatting. It's very technical. You definitely want to have like someone supervising you with that or have a really, really good base for that
Yeah.
because yeah, it's a high risk. All it takes is one rep. That's off, and you could really hurt yourself. But that's why
Mm.
for me, like I switched mainly to machines just because there's almost no risk. Like you really
Yeah.
can't hurt yourself in a machine. You can load that thing up. You can get more targeted strength training with no
Yeah.
risk. And for me, my own goal, like I don't want surgeries or injuries myself. And it's like
Yeah.
obviously I still want to look good and feel good, but there's an easier way of doing it that's way lower risk.
Yeah. You see, doing some research, you seem well traveled.
Yeah, I'm a
You've
huge
been a lot of
traveler.
places,
Yeah.
right?
Yeah.
What do you see when you're like traveling from your mindset of like, oh wow, this culture in the way that they treat health, food, just lifestyle in general is so different than America?
Honestly, I think whenever I've been to like 60 plus countries, it's
Yeah.
always like coming back to America that it's like, oh, what are they doing here? Like, what are we
Yeah.
not doing here? It's like every other country, I think, has a very healthy relationship with like they walk, they eat fresh food. It's like I love Italy. I
Yeah.
can eat all the pasta, carbs, everything there, and I feel great. And it's
Yeah.
just different ingredients, pure ingredients there.
Yeah.
But they also, I mean, you walk 5 or 6 miles every day. I think
Yeah.
most cultures kind of have that as just the baseline versus here, it's very sedentary. It's very processed food. It's different. I think the way our culture is too is also much more oriented towards a quick fix. You want it right now.
Yeah.
I think versus like Europe and stuff, like when you go to dinner or go to lunch, you're there for 2, 3, 4 hours. And that's just kind of like you're just kind of there or like summer break. They're just gone. There's, they're on vacation
Chilling.
and much, it's
Don't
like way
call me.
better. Yeah. Like
Yeah.
stress wise, job wise, like
Yeah.
it's kind of like the are you working to live or living to work? And it's like I think here in America it's very, very different. And like we work a lot. We have a lot more stress at work. We have a lot more stress in general. I think our
Yeah.
lifestyle is also just putting a lot of stress on our bodies of like we're not meant to just sit for 8 or 9 hours
Yeah.
a day and then like that's what I think is funny to me of like even gym culture and stuff too. Of like, sit for 10 hours, then in 1 hour, it's like, I will lift everything, I'll move everything, let's do it all right now, and then go back to sitting. And it's like, at
Yeah.
least I got my like for 1 hour, I did everything. And it's like humans aren't meant to do that either.
Yeah.
But it's just our lifestyle is just so not I don't know, it's not catered towards that
Yeah.
it's tough to kind of impose that, I don't know, onto that lifestyle on American culture. But
Yeah.
I think,
It's a
yeah,
tough balance.
it is, yeah. But I love traveling and just seeing what other people are doing. And
Yeah.
yeah, I think it's a big world out there too.
It is. What's your favorite spot you've been?
I mean, all over. Depends what kind of trip.
Yeah.
But
Yeah.
I do love Italy. I go there the most often, probably just for food. I love pasta. So,
Yeah. Yeah.
but it's different over there.
Yeah.
But no, I mean, I love some of the outdoorsy places too. Like New Zealand's beautiful, Chile
Yeah.
is beautiful. I love Japan. I have a lot of
Ooh, that would
I
be
have a lot
fun.
of friends that are going there now just because it's a lot cheaper right now. But I don't have time to make it over there. But
Yeah.
yeah, their culture, their food, everything's great.
Amazing. What's next for Members Health Go? Like what's the grandiose vision?
Yeah, I mean, I'm actually scaling soon, so
Cool.
getting the location, another doctor onboarded currently to
Amazing.
open up a location in the nations. I'm currently in Wedgwood, Houston, and really that's my goal is making this more of a neighborhood doctor feel in every neighborhood in Nashville. I think this is something where Nashville is definitely a health conscious city, younger city that really benefits from something like this, where I think there's this huge service industry as well where you may not have insurance and like you don't have to pay $600 a month for health insurance. You could just come do this and it's
Yeah.
189 a month. That is so much cheaper. Obviously, I still recommend a catastrophic plan for like 80 to $100 a month, but that's still a third or half of how much
Yeah.
you're paying. And you actually get something and all your wellness stuff too. So it's not just medical, it's everything really with a meal prep, with like, I
Yeah.
don't know, IV hydration, Botox, everything,
Yeah.
all with your doctor. So I'm excited to
Super
keep going
cool.
from here, man. But just doing real health and just showing people
Yeah.
health is easy and cheap when you cut out the middleman. That's just the problem. They
Yeah.
make it seem like it's this big, confusing system and all these
Yeah.
layers, and it's not. It's really easy.
Super cool. I love what you're doing. I think it's an incredible idea. I think, yeah, I mean, you definitely have. Like, I didn't even think about the service industry piece for Nashville. I mean, that's brilliant, and it's just needed in general.
Yeah.
Like, yeah, it's just needed. I mean, it's a big gap, and I think you approach it the right way, and I have a feeling it's gonna be massive for you. So kudos to starting it.
I appreciate it.
Yeah.
Yeah, I have to come see it sometime. We'll do your
Yeah.
blood work.
Yeah, absolutely. We already made the promise. I gotta come. I gotta come do it. But where can everybody find you if they're listening and they want to come check it out?
Yeah, our Instagram, Members Health Co. You can see what the clinic looks like. It does not look like a doctor's office. I hate doctor's offices. That's why I've enjoyed challenging that aspect of it too.
Yeah.
Like, there's no rule saying a doctor's office can't look nice.
Yeah,
And if
yeah.
I have to be there all day, I want it to look nice too. So
Yeah.
my background's actually design, so I have
Yeah.
a lot of fun designing it myself. But
Yeah.
their website, membershealthco.com, has all the information about my clinic and how to enroll or questions you have. happy to, yeah, text me, email me, DM me on Instagram,
Yeah.
all the above.
Awesome. Thank you, Dr. Rahul, for coming on the show. It's been an absolute pleasure, guys. Go check out Members Health Co. here in Nashville. And thank you for tuning in to another episode of the Breathe and Air podcast. We'll catch you next week.
Awesome. Thanks for having me, man. That was
Yeah.
awesome.